I got the email on Wednesday evening telling me that I had been randomly selected to come and get my swab test here at Park Center. And I read the whole email, which was a lot, but you gotta read the whole email. And in there, I learned a few things. So first, I had to actually click on a link in the email and go and register myself. And you wanna make sure you do this ahead of time because it actually asks for some insurance information. It's required. So if you're a student, you might actually need to call home and ask mom and dad for that number. So make sure you're doing this ahead of time. And then you want to fill that out all the way until you get to a screen with a yellow triangle that says, click this button after you get your testing kit. So you want to make sure that you do that. Then read the rest of the email because it tells you what time you're supposed to come. So I had 8:40 and it told me what group I was in. I was in group B today. And it also told me not to eat or drink anything for 30 minutes before coming in. Don't brush your teeth for, it was 3 or 4 hours before coming in. So I haven't brushed my teeth, y'all. Don't smoke, don't use nicotine products or smoke before coming in. I think those are all of the requirements for the right before you get here. So then you get here and you're on the side of Park Center that is facing professional studies, that parking lot over there. And you wait at the door until they invite you in. And then when you come inside, there's circles on the floor for you to follow to make sure you're standing 6 feet apart. And then there's 3 stations inside. The first station itself is the person who checks your information, looks at your ID, and then when you're done there, you go to the next station where you get a QR code that they're actually going to read to you. You'll type into your phone, which is why it's important to bring your phone with you. So you type that in, and then they give you the test kit, and then you move to the next station where you open the test kit and you actually do the swab. So you have to actually use the giant Q-tip on your cheeks, your gum line, and under your tongue for a certain amount of time, but they count that for you. It's like 15 seconds. It's really not that long. You have to avoid your teeth so you don't get like plaque and other things on that because they just want saliva on the swab. And then you unscrew the top of that, you put it inside, you screw it, you shake it 15 times, and you hand it back and you're done. So I think the whole process from station 1 to station 3 was probably 5 minutes. It wasn't long at all. There was no discomfort, no pain. I've had the nasal swab myself, so I know I was a little nervous, and then I got here and I was like, okay, this isn't so bad. And then once you're done, they just send you out. So it's actually a really easy process. Everybody's safe. There's lots of hand sanitizer. Everyone's wearing masks. The people that are working are wearing gloves also to help protect us and protect themselves. So this has been a really good experience, I would say, for me today. And I encourage you to make sure you, again, read that whole email. It's a lot of information, but you got to read all of it before you come in. As a faculty member in the health department, I teach in community and public health. And it's really important that all of us are participating in this on campus because it's helping to keep our campus safer. It's helping us to understand how many people might be impacted. You are randomly selected to come, so it's not like they're calling one specific residence hall at a time or anything like that. So this really gives us a nice snapshot of whether or not we can stay on campus safely. And in the end, that's really what all of us want, are to be here on campus together, even though it's a little weird, staying 6 feet apart, not being allowed to have visitors in our rooms. All of that's kind of crappy, but it is what it is. And this is the best way we can still be here together. I can still see you in my classroom, and you can still participate in face-to-face learning, and that's what we really all want. So in order to do that, we've got to participate in the measures to keep campus safe, which include testing, wearing our face coverings all the time over our nose and mouth, no face penises hanging out. Always make good decisions there. And remember, even if you're off campus, you still need to wear your face coverings. The virus stays in the air for 4 hours, even if you're outside. So if you're downtown and there's other people outside downtown like there always are, you want to make sure you're still wearing your face coverings down there in case you have the virus. You don't want to pass it on to someone else. And you also want to make sure that you're doing whatever you can to protect yourself. So this will protect you a little bit from getting what someone else might be spitting out of their mouth. So make good decisions so that we can all stay here together until Thanksgiving.